Hello and welcome to this Lancet webinar on health and climate change. My name is Tamara Lucas and I'm an executive editor of The Lancet and one of the co-chairs of today's webinar. 2023 is an exciting year as we mark the 200th anniversary of The Lancet, and we're taking this opportunity to shine a light on crucial health issues, focusing particularly on 5 themes that we call spotlights. These are universal health coverage, health and climate change, research for health, mental health, and child and adolescent health. This webinar is our first for the Spotlight on Health and Climate Change, and today our expert panellists will be discussing aspects of how health and climate change interact in policy-making contexts, including an audience Q&A for the last 15 or 20 minutes. Some housekeeping points. Attendees are welcome to submit questions throughout the presentation. Please use the Ask the Question box that you'll see on your dashboard. On the dashboard, you'll also see a box with related Lancet 200 resources. A link to our Spotlight on Health and Climate Change content is featured, and that will take you straight to thelancet.com. You can adjust or minimize any of the boxes that appear on the webinar dashboard to suit your own preferences. And a link to the on-demand version of the webinar will be emailed to all people who registered once the webinar has concluded. Once it's ended, please do complete our 30-second feedback survey so that we can continue to improve our webinar offerings. So on to health and climate change. The relationship between health and climate change has been championed by The Lancet for over 30 years, for the past 3 decades. And as a journal, we've increased the profile of that interaction through quality research and multiple reports and commissions. These together have established beyond doubt that the climate crisis is a health crisis. Our publications include the annual Lancet Countdown report, which is publishing for the 8th time this year, the Eat Lancet Commission, and several other projects that have been greatly impactful, such as A Future for the World's Children, a WHO UNICEF Lancet project. All of them affect real lives and also illuminate scientific understanding. Policy change, however, is the goal that can really make a difference, locally and globally. So this is the specific interaction we're going to be exploring in a bit more depth today. Our panel experts on multiple aspects of this interaction, as medics, educators, and influencers. So drawing on their experience and knowledge, we'll delve deep over the next hour or so into obstacles, successes, and goals for the future. Over to my co-chair, Chloe.
Thank you so much, Tamara, for those introductions. And thank you so much to everyone for joining us in this Spotlight webinar on health and climate change. So my name's Chloe Wilson, and I'm a senior editor here at the Lancet, and I work primarily on the comment team. And before I started working at the Lancet, I was a clinician in the NHS. And even within my own practice in the UK and elsewhere, I've witnessed firsthand the effects of climate change on human health, be that with people presenting with health problems related to climate change, such as heat stroke, induced kidney failure, and cardiovascular events, people presenting with respiratory problems related to air pollution and wildfires, and people displaced from their homes by extreme weather events and rising sea levels. The 2022 Lancet Countdown on Health and Climate Change reported there was an increase in health-related deaths by 68% between 2000 to 2004 and 2017 to 2021. The climate crisis is urgent and a global problem that demands an urgent response. And there's a really clear need for healthcare professionals to develop the knowledge and the skills that allow them to address the effects of climate change. And we've had some really great comments at the Lancet written by healthcare professionals, urging others to think about climate change both in their daily clinical practice by reducing the waste and the contribution to health systems through reducing and thinking about thoughtful prescribing, and also in terms of procedural waste. And you can find links to these really great comments on our Spotlight page. But healthcare professionals also have a vital role in communication and on advocacy in terms of climate change mitigation and adaptation, and I'm really excited to introduce to you the panel of speakers to further explore the role of the health voice in climate policy. So back to Tamara to introduce our first speaker.
Thank you, Chloe. I would like to introduce Lujain Al-Qudmani. Dr. Lujain Al-Qudmani is the Director of Global Action and Project Portfolio at EAT and is a member of EAT's senior leadership. Lujain is responsible for the implementation of EAT's strategic goals, oversees all of EAT's projects, and measures the overall organizational impact. Lujain has a background in global health and medicine. Prior to joining EAT, she worked in various positions, including serving as an emergency physician in Kuwait. In addition to her work at EAT, she is also the president of the World Medical Association, the WMA, for the term 2023 to 2024. Lujain, you wear multiple hats, and it would be great for you to apply both to tell us about your experience of health and your upcoming presidency of the WMA. Thank you.
Good day, everyone. And before I answer your question, Tamara, I just would like to underline the dire consequences of poor diets before jumping in onto the policy side of things. Diet-related illness is now the #1 driver of ill health and premature deaths in the world. Actually, 1 in 5 deaths are linked to unhealthy diets. So the human cost of that is just mind-blowing. And add to that the cost to our health system and economies. The annual economic cost of unhealthy diets in the UK, for example, ranged from 5.8 to 6 billion pounds. The numbers of chronically hungry people are also on the rise, estimated between 720 to 811 million people in 2020. Around 150 million stunted children who will never reach their full potential physically or mentally. So think about the suffering and the cost of that. Also, micronutrient deficiencies, cost of poor diets. 3 billion cannot afford a healthy diet. In addition, such diets is killing our planet. Current food systems are responsible for about 1/3 of our total emissions. They're also the principal driver of the global extinction crisis, the loss of biological diversity, and the destruction of nature. So in order to urge governments and other actors to take serious actions to shift towards health and sustainable and equitable diets, we had first to answer the one simple question, which is how to feed 1.9 billion people a healthy diet, leaving no one behind, and without destroying the planet. You've mentioned it, Tamara, in your remarks earlier, which is the EAT Lancet Commission. EAT partnered with the Lancet and established this scientific commission to set for the first time ever science-based targets for health and sustainable food systems, including defining to what we call planetary health diet, which is a flexitarian diet that is plant-rich with some meat, dairy, and seafood, but fundamentally plant-rich. Now, to adopt such diets, and now shifting towards the policy side of things, businesses and governments have a very important role to play, creating a healthy food environment, ensuring that healthy and sustainable food is actually affordable, desirable, and accessible, as the responsibility for healthy and sustainable food system is evenly shared between stakeholders. For example, governments can and should develop and implement what we call healthy and sustainable food-based dietary guidelines, enhance marketing regulations and transparency, integrate true cost accounting into national or regional policy and budgeting, standardize marketing labeling, and write fiscal policy subsidies on the healthy and sustainable food, and taxes on unhealthy ones, and many more. Businesses, which is another important key stakeholder in sustainable food systems, businesses are engaging with and informing consumers, create new marketing tools and right incentives that is centered around people. Be transparent about true prices of products and be responsible and transparent by providing front of packet labeling schemes and promoting the healthy choices. It's obvious that there is no one size that fits all. So interventions needs to take into account the local food systems, the cultural connotations, and literacy levels. This will not only inspire, motivate, and empower people to take actions and enjoy the right food options for them, but also will create the movement of people that is better informed and can demand for strong actions for a better future. Now, as a physician and a healthcare professional, I strongly believe that physicians have an important role to play to increase consumption of healthy diets by conducting dietary assessments, providing professional counsel, support education and training, and drive major advocacy efforts. Now, this applies not just in the area of food and health, but also when it comes to climate change. So in October this year, I will be inaugurated as the president of the World Medical Association, a prestigious international organization that represents over 1.9 million physicians in 114 countries. So as the upcoming president of one of many vocal civil society organizations that's very active in climate space, that even declared a climate emergency, I'll continue to urge governments to place health on top of their climate agenda and national adaptation mitigation plans. Second, to mobilize funding to strengthen healthcare system resilience and support climate and health research and capacity building. And last but not least, facilitate the active participation and involvement of health sector representatives. Tomorrow I will stop there and happy to answer any follow-up questions.
Thank you so much, Jane. If it's okay, we'll keep the questions until the Q&A at the end, and we'll move on to our next speaker. So next, I'd like to introduce Rhiannon Osborne, who's a recent graduate from the University of Cambridge in medicine and will be starting as a foundation doctor. Rhiannon is a co-founder of the People's Health Hearing and coordinator of the People's Health Movement UK, which is described as a global radical movement based on the right to health, resisting colonial capitalism and building a just, healthy world. In addition, Rhiannon's a member on the Urban Health Council and on executive committee of the UK Health Alliance on Climate Change, in addition to many others. And Rhiannon, I know you've done a lot of work with frontline communities, and it'd be great if you can tell us in your talk about how the health community can better advocate for climate and health justice. So over to Rhiannon.
Great, thanks. So my talk is going to be an argument specifically for the health community to move beyond the delusion of dialogue with industries such as the fossil fuel industry and move strategically to using the power of the health community to dismantle the industry. And this talk is mostly based off an analysis and argument for the health community, which was put forward by myself and Abby Devanagam earlier in the year. And in this paper, fundamentally, we argue that the health community is focused not entirely, but mostly on emissions, mostly on the consequences of the climate crisis, and mostly on healthcare, has limited its effectiveness because it's failing to analyze the root causes of the climate crisis and their health impacts, such as an economy which relies on environmental degradation and the destruction of health and life, which has resulted in the climate injustice that we're witnessing. And without an adequate political analysis, the health community has multiple critical blind spots, which are discussed at length in the article, and alternatives offered to, and I'm going to focus on two of these today. And hopefully, if you take one thing away from this talk, it's that increasing awareness of the relationship between health and climate is not an inherently good thing unless it is used strategically with political and power analysis and a commitment to climate justice. So first, I'm going to talk about a common belief that is held in the health and climate space, which is mirroring previous mistakes that have been made regarding calling industries like this stakeholders, such as the formula industry, or indeed many agribusiness companies as well. These companies are incredibly violent. So I'm talking specifically about the fossil fuel industry, but it applies far beyond the fossil fuel industry. Their business model has always relied on polluting land, displacing people, creating violence, and destroying communities. And if we look at the health impacts of fossil fuels, for example, as only coming from emissions and the climate crisis, this ignores the centuries of violence that have been implemented in order to extract oil, gas, mining commodities, basically since the start of colonialism and capitalism. And the People's Health Tribunal of Shell and Total, whose verdict is on the screen, outlined what reparative justice would look like for 4 communities who have been devastated for decades, if not longer, by the companies Shell and Total in the Niger Delta, South Africa, Mozambique, and Uganda. This is something that the health community rarely talks about, and that's the fact that the health and life that has been actively stolen by these companies has to be repaired, and true health justice would likely result in these companies no longer existing. That's not only because of the scale of monetary and non-monetary reparations that they owe, both because of the harms of extractivism and the loss and damage and climate reparations that they owe for the climate crisis, but because their business model is incompatible with health and life. And many people have rightly called these companies genocidal and ecocidal. And simply calling for these companies to transition to renewables, which is something that they have shown they will never do willingly, also legitimizes their violence as if everything other than their emissions is acceptable. And these are some of the most brutal companies that have ever existed. And many people have died trying to stand up to them, and they should not have any place in a just future, let alone in an energy system. Building on this, but slightly different, is false solutions, which are commonly kind of propagated within the health community. And the main one being net zero, which is widely promoted within the health community. This is an excellent report on why net zero as a concept and as a policy is really dangerous. It promotes continued fossil fuel expansion, basically relying on either future technologies which don't exist and or mass land capture in the global south for carbon offsetting, which also doesn't work. This should be basically challenged, not endorsed by the health community. The health community, the health community is also in a great place to challenge what is called green imperialism or green extractivism. And this would involve challenging the concentration of wealth and resources in the global north as an essential part of an energy transition. Green imperialism or green extractivism basically refers to arguing that the existing system of resource theft from the poor to the rich is fine, and all that needs to happen is that the inputs to that system need to be changed from oil to something else. This would not tackle and does not tackle the mass ecological destruction caused by endless profit-driven economic growth, and will also do nothing to tackle the health consequences of mass resource inequality. And I think it's really important to emphasize here that the problem is not a lack of resources, but their distribution and who controls that distribution. Fundamentally, this corporate control of the climate and ecological crisis means that the solutions being proposed and implemented come from the same ideology which created the problem, such as colonialism, the supremacy of humans over nature, the idea that health is an individual phenomenon determined by your behavior or genetics, and is allowing the continuation of the idea that the market can and should control everything we need to be healthy, including, water, air, soil. And this is something that the health community is in a great position to challenge rather than kind of fall into. And so, finally, I'm just going to end on some recommendations from our paper and from wider work that we do, is to move basically from an emphasis on evidence alone to a power analysis. Because whilst evidence is important, we know that the climate crisis is fundamentally a political problem, and it's a political problem based on who is deemed sacrificable to the profits of the global economy, which normally falls along lines of race, gender, class. And a power analysis allows us to challenge this and allows us to understand the real drivers of the climate crisis. And it also helps us to see and identify the systemic infrastructure which holds up the fossil fuel industry. That includes the military, who are not only one of the world's greatest emissions producers, but also brought in, along with the police, to protect the interests of the fossil fuel industry. And it also includes things like global trade rules and investor-state dispute settlements. And so what this political analysis allows us, I hope, is to realize that the solutions will not come from begging people who are doing this deliberately to listen to evidence, but from building enough power to fight them. And that is what movements across the world have been doing for centuries. And that's basically what I hope to do in my work, and what I hope that more people in the health community should do, basically. So yeah.
Thank you, Rhiannon, for such an impassioned talk. That was really great, and I'm looking forward to seeing some audience responses to that. Unfortunately, our next speaker, Professor Jamila Mahmood, has had some unexpected connection issues and has been unable to join the event live. We're still hoping there's a chance she may connect by the Q&A, but meantime, this morning, she's very kindly recorded a video message of her talk as an alternative in case not. So, Dr. Jamila Mahmood is a medical professional with more than 2 decades of experience managing health crises in disasters and conflict settings. She's a professor and executive director of the newly established Sunway Center for Planetary Health at Sunway University, Malaysia, and will now play her video recording.
Hello everyone, it's a pleasure to join this webinar. I wanted to really, when I was broaching this subject, I thought back about my own medical education in Malaysia, graduating in 1986, where the issue of climate and health was not something we were exposed to. Fast forward, even when I was teaching in medical school in the 90s, it was still not a subject that was taught. I think the realization of the health implications of climate change in the region is not as advanced as perhaps in the West. In fact, climate change and the awareness on climate change is very, very patchy in the region. An Ipsos study done showed that while there was some awareness, there wasn't really a sense that it was something that affected us in the region, whether it has health implications. I think the knowledge level probably and the awareness is fairly low, and I think we need to do a lot more on that before we can actually move the discourse towards climate and health. I am based at Sunway University in the Sunway Center for Planetary Health that I lead, and we are doing a lot, to push planetary health on the agenda. And in the 2 years of our center being up and running, we have made quite significant progress. First of all, being able to influence the development planning or development program planning of the country for the next 5 years that includes planetary health. In Malaysia right now is starting on a journey, a 1-year journey to develop a national planetary health action plan, which takes into account the importance of planetary health, the impact of environmental degradation, planetary degradation on humanity and on health particularly, that will transcend education, health services, economics, social well-being, and equity for all. So this is a really positive step forward. We hope that by next year, in May next year, we will have this action plan ready. It is a government-led initiative, but a multi-stakeholder process. And I think with that, we can really start advancing, the whole discourse around planetary health, the impact of climate change on health in this country particularly, but also in ASEAN writ large, as Malaysia chairs ASEAN in 2025. Now, what do we do at Sunway Center for Planetary Health? First of all, we're looking at how we bring the whole discourse on planetary health, which is, of course, includes climate change and health, but also pollution and other aspects of planetary degradation. And we are doing this through not just the School of Medical and Life Sciences, which includes nursing, allied health and public health programs that we will be developing to really incorporate, planetary health into the teaching curricula. But beyond that, we're doing something really quite revolutionary, I would say, and that is a 7-week program on planetary health where every undergraduate student enrolling into the university from next year, 2024, will have to do a mandatory 7-week course on planetary health, where they will apply the knowledge on the impact of planetary degradation on health writ large, on humanity, to the disciplines that they're studying. And I think this is how we move the needle. It just cannot stay within the health fraternity. It has to go beyond. And central to this is really recognizing that the determinants of health are beyond the health sector. They are environmental, social, behavioral, economic. And I think this is how we start having that discourse. So that's on the more formal form of education. But on the informal education, there's a lot being done in really trying to educate young children around, the importance of climate change, but also showing them that planetary health angle, how it impacts health. I believe that the recent pandemic has provided us a real opportunity. It's still recent enough in everyone's memory, although there are times where I wonder whether people have really forgotten that we went through a pandemic, the way we behave nowadays. But certainly not too distant a memory for us to trigger back, the emotions that we all underwent, had undergone during the last 3 years, that can actually then put the focus back on health, and recognizing that in the region, in Asia Pacific, in the ASEAN region, we are really in a climate hotspot. We have a lot of hydrometeorological disasters. There are now increasing heat waves that never really used to be significant in my country or in the region. And this is now putting a spotlight on the health issues that are there. So, apart from that formal education piece, I think we need to bring in the informal public knowledge, increase in public knowledge and understanding, which is very, very important. So moving forward, I think we can learn from the Canadian Physicians Association, where they have come together, the medical fraternity in Canada, to really re-examine the curricula that is being taught in medical schools or in health-related schools, and how do we bring in this understanding of climate change and its relationship to health. One aspect that is rarely, taught or even thought about in my country or in this region is really about mental health and climate change. And this is something, at the Sunway Center for Planetary Health, we're really wanting to put a spotlight on. Again, we need to take into consideration cultural, regional perspectives on mental health. In my country, certainly, there has been a lot of stigmatization on mental health. But again, the pandemic, COVID-19, has offered us that window of opportunity where the mental health impact was so obvious and so prominent, and it became more open. People could talk about mental health issues during the pandemic, and now it allows us this opportunity to broaden that engagement to the issues around whether it's climate anxiety and climate change. So I think we are doing quite a lot in engaging with young people informally. To what we run is climate courage workshops, where we really tackle head-on the impact of climate change on mental health. And I think with this, we'll start gaining a broader understanding and slowly bring this into much more formal education. So it's still some way to go, but we're certainly, heading in the right direction. It is now an imperative that we can no longer ignore in this region. And certainly my colleagues, the center that we run through the Planetary Health Alliance as well, will be doing a lot more and trying to raise more awareness around the impact of climate change and health.
And we thank Jamila for that pre-recorded video. Certainly a lot for us to think about and a lot to discuss in the Q&A. So next, I'd like to introduce Dr. Stella Hartinger, who's an Associate Professor and Environmental Epidemiologist at the School of Public Health from UPCH in Peru. She's the co-director of the Latin American Center of Excellence for Climate Health and leads the Lancet Countdown Health and Climate Change in South America. She's got a vast experience in randomized health interventions addressing environmental health problems and studies generating knowledge about climate change and health in Peru. So I was going to ask you, Stella, how climate policy specific to Latin America can policy reflect the inequality of experience of the crisis, and what makes the Latin American perspective unique, and what global lessons are there?
So thank you very much for that introduction and for that very big question. So I will actually start by talking about the Lancet count on South America, how we actually, how it actually came to be. That I think it opens to a very to the big question that you just asked me. So we already know that climate change poses multiple threats to the health of South American populations. We know and we see intensified storms, crop production disruptions, floods, droughts, infectious diseases spreads, mental health deterioration, exacerbation of poverty and migration. However, the Lancet Countdown actually sees that addressing this climate change presents an opportunity for significant health benefits, such as cleaner air, healthier diets, and more livable cities. That's what we need. However, what we also saw is there is a growing body of evidence of the intersection between health and climate change, but most of it was coming really from high-income countries, making it a challenge to apply and generalize to South America, and I must say to other low-middle-income countries as well, which actually send an urgent need for regionally relevant research. In order to address that, the Lancet Countdown South America was established as a regional center. We are just one of 5 of the regional centers that we have. We aim to monitor the impact of climate change on well-being and develop national and local responses to turn the threats of climate change into opportunity for health improvement. As part of our mandate, we collaborate with academic institutions, research organizations, UN agencies in South America to promote and conduct research. There was a question right now in the chat that was saying that this is not really a problem for one person, and we agree. South America is really a multidisciplinary collaboration with 21 academic institutions, 21 researchers, but I think that the most important concept that we need to start talking about is transdisciplinary research, because we really need to involve not only academics, but the civil society and the policymakers. Our work in the Lancet Countdown focuses on building capacities through collaboration, promoting research, creating case studies and indicators, and finally developing the regional reports. When we actually started developing a regional report for this year that actually was launched, we quickly recognized that additional to the pathways already outlined in the global Lancet framework, South America has unique features and factors that require quantification and tracking at a regional level. This includes and are not limited to, for example, tropical glacier volume loss in the Andes Mountains, land use change in the Amazon rainforest leading to biodiversity loss, the impact of climate change in indigenous communities, and what type of adaptation measures will they need, the social inequalities we have, the uncontrolled urban expansion, and the diverse climate and ecological zones that we will start losing as well. But also, just as Jamila just mentioned in her video, education and education for not only medical professions, but really for all professions on the impacts of climate change and health is something that it's necessary and that we will also include in our future iterations of the report. As I said, this past March, we launched our first Lancet Countdown report in the Lancet Regional America, so we're very happy about that. And we had 4 key messages that I think it's important that I convey now and before we actually start the Q&A and the discussion. The first one is that climate change is harming the health of South Americans, and it's time to take immediate action. We know that we have not been responsible for what's happening, but we also know that if we don't have an immediate action or a response, we will not only see the worst effects of climate change on health in our population, but it will disproportionately affect the most vulnerable populations of South America. We also know that this trend will only continue if we don't take action now. The second key message that we had in our report is that South American countries must increase their preparedness to prepare the population from the health impacts of the climate crisis. Our policymakers must recognize and ensure the well-being of the populations. However, they need to understand what we are providing as evidence. And I think that here is also the gap that Jamila was mentioning in her video. Not many people knew or know what climate change and the impacts on health are going to be most of it is really focused within the Ministries of Environment, and the Ministry of Health is really just a sideline. And this is something that we need to change, and we need to help actually policymakers understand that they need to develop effective policy plans that need to include health in all policies. The third key message that we have in the report is that South America must continue and accelerate its efforts towards a zero carbon transition. In our case, in our region, it is very important for us to reduce land use change linked to deforestation, decarbonizing its energy and transportation systems. Those are the key things that we actually need to work towards too. Doing so, we will meet our Paris agreements. This is a given, but it will also provide significant health benefits through improvement of air quality, reduce energy poverty, reduce inequalities in transportations, and have more active lifestyles. And I think it aligns very, very nicely to what Lu Jian was actually saying about healthy lifestyles. And finally, the final key message that we have is that implementing climate change adaptation policies and actions for health and well-being needs investment and the support from governments that I think that Jose was actually mentioning. We need transparent financial commitments and specific budget allocations to actually do this. Without this, this will not move forward, and we will just be having these discussions next year, but really with no actions that are being taken. I just want to highlight one last thing before I stop, is that in the Lancet Council of South America has the commitment to expand our reach and engagement at the country level through effective communication and policy involvement. To achieve this, we develop policy briefs which serve as vital tools for presenting the research and our findings and our recommendations to non-specific audiences. This also includes to the lay audience and to policymakers. We think that this brief provides evidence based on that policymakers could actually do and empowered readers to make informed decisions. Furthermore, our authors actively organize in-country launches. We have around 3 or 5 per year since 2019, where we invite different types of people, different types of audiences, and I think it provides a valuable opportunity to engage policymakers in the general audience. One involvement of the Lancet Climate Change and Health that we have is we serve now, so I actively serve in the Congress Commission for Climate Change and Health in Peru. I think this is a very good example of the outreach that we have had and that we can actually start having in other countries as well. By engaging in these communities and its commissions, the Lancet's work has become an invaluable resource and hopefully can shape climate change policies and foster the integration of health in different climate actions, which is our final goal, right? So I think I'm going to stop here. I don't know if I actually went over my 6 minutes, but I think it's a good starting point for the discussion. So thank you very much.
Thank you, Stella. That was a really great talk, and I love that you managed to weave together other aspects of the speakers' presentations as well to show how everything's interconnected. Unfortunately, another of our speakers has unexpectedly had some connection issues actually during the webinar, Salim Huq, and has not been able to join us for his live presentation. So thanking everybody again for such stimulating presentations. We've had questions flowing in, so I'm actually going to start with the Q&A now, because there have been so many. So the first question, Lu Jane, if I could turn to you, please. There's been a question about how would you define what is a healthy diet, as it may be culturally specific. Is this something that you could talk about, please, perhaps in context of EAT and also future work that EAT is involved in? Thank you.
Yeah, happy to. Actually, one of the excuses that several governments have been giving us for their lack of action was there's lack of consensus or lack of definition of healthy diets, or even healthy and sustainable diets, which is actually not true, because we have enough evidence to act. I would say that in terms of the healthy diet, is a diet that includes all the essential micronutrients that is needed for a healthy life. For example, when we go through the planetary health diet to include some sustainability elements into it, if we imagine that an average adult would require 2,500 kilocalories as an average. If you imagine those calories, daily calories as a plate, half of that plate is fruits and vegetables, that is around 500 grams of fresh fruits and vegetables. And the other half of it, 1/3, includes legumes and nuts, with around less than 10 grams for free sugar, and flexible average for animal-based proteins, including dairy, eggs, red meats, as well as seafood. This is more like as a global definition. But as I said earlier, there is no one-size solution that fits all. This diet needs to be further translated at a national level, at a local level, to, I will call it, celebrate different cuisines and different cultures from different regions. If we see, if we translate that diet in a country in South Africa, for example, to maintain these healthy standards, as well as to maintain within the planetary boundaries, we ask for massive increase of consumptions of fruits and vegetables, and drastic decrease of starchy vegetables, while there's still some window to increase animal-based protein consumption, for example. If we look at a country in North America, to maintain within the same standards and planetary boundaries, there should be a drastic decrease in animal-based protein and a massive increase in the consumptions of fruits and vegetables. Now we have actually launched the second iteration of the 8th Lancet Commission, with a report to be published by the end of 2024, to revise the definitions of that planetary health diet, and even to consider different comorbidities and the regional translation for such diets.
Tamara, can I add something to that? Yes. Okay. So I just wanted to add a couple of comments related to diets and how actually it links to climate change. So we have actually an indicator in the Lancet Countdown where we see what are the health co-benefits of changing our diets. So, and why is this so important in our region? Because what I was saying is we have land use change in the Amazon. We have an agricultural expanse that actually increases emissions. And if we could actually change to the diet that Dujan was actually mentioning, we could actually reduce around 150,000 premature deaths in our region already. These deaths are concentrated in Brazil and Argentina, and they are linked to the consumption of red meats in these two countries. So this already, what Liana is already saying, will actually have a massive impact if we could steer our diets to being a little bit healthier. So I just wanted to bring that in because it's such an important topic that we discuss in our region already, and it has such important implications to greenhouse gas emissions. And I just wanted to mention that and contribute there as well.
Thanks,
Thank you, Stella. No, absolutely agree.
Sorry, just want to add to that number that actually, according to the 8th Lancet Commission, adopting such diets will also save 11 million premature adult deaths every year. So that's, as far as was, of course, a massive.
Yep, our numbers come just from South America. I guess those numbers must be bigger worldwide.
Thank you so much, both. And also, so with the next question directed towards Rhiannon, but please feel free once Rhiannon's answered to jump in as well. So this one is thanking everybody for their insights, and then asks, breaking the silos between different sectors are important. What do you think about the role of citizen science in climate change action?
Okay, sorry. Is it citizen science or citizens? Or both?
It said citizen science in the question.
Cool. I think I wouldn't say that I know loads about citizen science, actually, personally. I think one of the things that I maybe would highlight, which I think is useful for the health community to like reflect upon, is that we often have this idea that like health research and health evidence has always been used for good, and like the health community does no harm, and that health systems and public health research is always used to support health justice. Whereas actually what we see when it comes to extractive industries is an awful lot of the health system deliberately kind of gaslighting or being used to undermine communities who are saying that an extractive industry is really harming their health. So, for example, in the Yucatán territories in Colombia, where they are resisting a massive Glencore mine, which they estimate is causing the deaths of up to 40 children in their community a year, they often get told that it's because of their behavior, that they are not behaving right, that they're not using the right diets, and that's what's causing the deaths of their children. And you have like health systems and health authorities really playing into that, and that builds on in the climate discourse as well, the individualism narrative, which comes from health a lot and neoliberalism in general, and then is transferred onto climate. So, for example, the personal carbon footprint calculator was invented by BP in order to distract attention from them. And similarly, like a lot of agribusiness companies like to emphasize the importance of people changing their diets personally in order to take the attention off them and their lobbying and their deforestation. So I think taking these things together, citizen science can be, in particular, like when it's used to prove that an industry is damaging health or to prove that policy is damaging health, can be used to basically help resist fossil fuel expansion, to resist deforestation. But it's incredibly difficult to get that evidence out there. It's often undermined, it's often delegitimized, because it's a direct threat to power. And what lots of the communities in the Niger Delta have been doing is trying to prove, using health evidence, that Shell and Shell's oil spills have caused the high rates of cancer and the low life expectancy there. And the challenges that they have faced, both in terms of like threats, legitimacy, in trying to prove that, are immense. And so I think that citizen science, I mean, it depends what you mean by citizen science, but like using health data alongside, like basically in not as like something that's separate and oh, isn't this nice, we're going to observe this injustice, but as a tool for people who are resisting the causes of the climate crisis, I think is really powerful, but has to be done, I think, with the knowledge and humility that the health system has and often is being part of gaslighting communities and part of colonialism, and has a very long history of doing that. So that's kind of how I'd answer that question, but I'm not an expert in citizen science, really.
Thank you, Rhiannon. I'll maybe move on to another question, which is relevant to what Rhiannon has just said, but also perhaps Stella, as well as Rhiannon, you might be able to have a go at answering this. And this is a question that's come in from Dr. Frances Maguire, who is asking about specific audiences for research on health and climate change, and how communicating with them can change the power dynamics of fossil fuel dependency. So I think that's really interesting, because while we've covered an awful lot of global ground here, I do wonder about the audiences that are reading the core research and what the steps. So if I could direct Frances's question to maybe Stella, you could have a go first, and then Rhiannon, perhaps you would also have some comments on this, and Lou Jane as well, if you do. Thank you.
Thank you, Frances, for your question. So it's actually a very good question. And most of the indicators that we've developed within the Lancet Countdown are really multidisciplinary in research. We have more than 2 disciplines that are actually contributing and defining what we're doing in these indicators. However, I do agree with Frances that we have to have a more transdisciplinary approach already. We need to just go away, because what we've been doing up until now is just creating the research, doing policy briefs, doing events, going to Congress, talking to policymakers. But I think that we're in the moment where we actually have to include them in the process from the beginning. I had a very good conversation yesterday with the Pan American Health Organization representative here in Peru. And it was an eye opener for me, because I thought that we were already engaging them. I thought that they were already part of the process from the Lancet regional report, and he said, yes, we are, but we want to be not only an spectator that you come and reach us maybe at some moment during the events or some moment when you want to have a bigger audience, or you have to engage us now. We want to be your partners. We want to walk with you. We want to walk with you, next to you, helping you write this report already. So I think that for me, it was yesterday, Tamara. So for me, it's a really wake-up call saying, you know what, they have to be part of the process. They have to be part of the solution. And we actually, as researchers, also need to hear what other civil societies are telling us that we should be doing, not only with this report, but with the evidence that we're finding. And I think this is where civil society fits so nicely. We work with very nice NGOs that are leaders in South America, and they can actually guess what we find, this complicated analysis that we do, and they can simplify it in a way that really lay audiences, civil society can understand and can actually use the facts in the correct way, I hope, and not confusing more. So I do think that Francis, we need to move a little bit more into transdisciplinary research, which is very complicated and hard to do. Don't get me wrong, but I think that's the path where where should we going?
Thank you. And if anyone has anything else to add, please do. Otherwise, I will go on to asking Lou Jane the next question. Okay, so the question that I had for you, Lou Jane, was, this question asks, so climate change may impact on the nutrition of children and mothers. Nutrition and food security are important areas of public health, but easily ignored by governments dominated by short-termism. How can we put this on governmental priorities?
Yeah, thanks, Ellie. This is a very good question. And this is kind of the heart of our job, is to ensure that the governments have this as a priority, and we have a strong political will to accelerate action. First is, and also building on to what Stella has mentioned, such actions by the governments and other actors actually need a cross-sectoral and multidisciplinary collaboration and partnership. Because at the end of the day, we're talking about a system change that will not be possible if we operate in silos. Unfortunately, despite the growing evidence that we have right now, several governments, they still aren't able to break those silos. So we have action that focus only on environment, or only from environment perspective, or from economic perspective, or from a health perspective. So having a multidisciplinary and cross-sectoral action by involving also non-state actors, including civil society organizations, businesses, academia, farmers, indigenous groups, youth, and many others, is quite essential. Second, most governments have committed and signed on to deliver the Sustainable Development Goals and the Paris Agreement goals. But what they don't realize that it's not possible to achieve any of those SDGs nor the Paris Agreement goals if we do not act on food, if we don't ensure a healthy and nutritious diet is available, affordable, and accessible for all without anyone behind. So also having it from that perspective would push the governments even further to act on not just nutrition and food security, but food systems in general. Third, there has been a growing massive civil society, even citizen movements all around the world, demanding accelerated actions when it comes to climate. And several governments have actually responded to that. Similar ones are now emerging when it comes to food. I would like to mention Canada as an example, where they have been increasingly linking their climate actions into food. An example of that is to establish their sustainable and healthy food-based dietary guidelines, where they have built on many of the growing evidence. Much recently, only a few months ago, Norway have followed through. The question is whether that's going to be actually and effectively implemented is, of course, a question mark, but at least there is some progress there. I'll stop there, Chloe.
Thank you, Lujane. That was a really comprehensive, helpful answer. We're almost out of time, so I'm now going to direct a question to Rhiannon. And I do apologise for the number of questions we've had flooding in, and we've had to pick a few of them. But this question is from Larry Linenschmidt, who asks, in general, our alternative energy systems are not adequate to power the needs of the world. Transmission lines, for example, are not sufficient to move green energy from source to place of use. How would the panelists address the need to both clean up our energy production and provide for the needs of people?
Yeah, and I think this is a really great question about needs and resource use and the idea of scarcity, or that there isn't enough. And so I think the thing that to bring out in this question is power, like the needs of people. And I think before saying, oh, is renewable energy enough to power the needs of people, we have to analyze whose needs are being powered at the moment and where are resources going at the moment. So 100 companies are responsible for 70% of the world's global emissions. The top 10% of the richest people in the world produce more carbon emissions than the bottom 50%. We have huge amounts of resources going to things like the military, to things like hyper-consumerism. And instead of thinking about, oh, how will we possibly power the needs of the world, we have to think about whose needs are being powered at the moment, right? So we have ecological destruction, mass ecological destruction, not just emissions, but all other planetary boundaries being reached, alongside mass inequality. And that is because the economy is not actually set up to meet people's needs. It's set up to meet the needs of capital and capitalism, which is mass, endless profit expansion, basically. So we need to transition our energy system to like a decentralized, community-owned renewable energy system. But we also need to significantly reduce the consumption of the rich, the consumption of corporations, and the resource exploitation, which the global majority are experiencing. And that is encompassed in various different proposals like degrowth, like Buen Vivir, about challenging this idea that there are not enough resources, or that currently, or that things will be worse if we reduce resource use in rich countries, when actually the current economy is not set up to meet anybody's needs really, except the needs of the super rich. And moving to a sustainable economy, including like mass wealth redistribution, basically, is both essential for, that's basically what health justice looks like. And so it's not a question of, can we do exactly the same on green energy? Because why would we want to do exactly the same on green energy? And this is an opportunity to like radically transform the world. And that's what I hope that health professionals get involved with, basically.
Thank you, Rhiannon. That was a really great answer. So I'm afraid that brings us to the end of this webinar. And I have to say thank you so much to our esteemed and by chance all women panel today. We've certainly learned a lot at this end and enjoyed the session very much. And I hope too that the audience has enjoyed hearing you all speak and has gained new insights. And again, I apologize that 2 of our speakers couldn't make the live event. Thank you too to the many people that have joined us online and taken time out of their day today. We've had a lot of questions that I'm afraid we haven't been able to turn to at all. So we are going to try and address some of them on social media, and we'll ask our panelists to respond. And we'll post some of these remarks online if you follow the Lancet on Twitter. And then finally, for our final sum up, please do browse thelancet.com for all of our content on climate change and health, all of which is free to read with registration. And you can access this content using the links provided in the related Lancet 200 resources box that you should see on your homepage. So thank you all again, and I hope that you enjoyed that as much as we did. Bye.